Hi, I'm Dr. Dickon Weatherby. I'm a board-certified naturopathic physician, and I received my naturopathic medical degree from the National College of Naturopathic Medicine in 1998. I'm probably best known for my work in the field of functional blood chemistry analysis, one of, if not the, most effective way to gather functional information from your patients. In 2003, I published what has become the seminal reference book on functional blood chemistry analysis, and I'm gratified to know that thousands of copies of this book are being used every day in clinics and doctors' offices all over the world. In 2012, I released my functional blood chemistry analysis software program to help analyze blood test results and generate a comprehensive functional health report. However, I soon realized that having an amazing tool like my software program would only be more effective and more powerful if I combined it with an in-depth online training. And so I created an online training program devoted to teaching functional blood chemistry analysis and providing you with the tools to be more effective in your clinics and practices. I've had the privilege now of training thousands of doctors how to do a functional analysis of their patients' blood test results, and would love the opportunity to teach my system so that you can get a ton of functional information from your patients' blood tests. Guess what test every one of your patients and clients have probably had done by their medical doctors? You guessed it, a blood test. And guess what 99% of them tell you when they mention this? Oh, I've already had a blood test done and my doctor looked at it and told me everything was normal. Well, one of the things to remember is that the majority of patients who present to us are feeling unwell, and they will come out normal on blood tests. Clinical experience suggests that these people are by no means normal and are a far cry from being functionally optimal. They may not yet have progressed to a known disease state, but they are what we call dysfunctional, i.e. their physiological systems are no longer functioning properly, and they are starting to feel unwell. Let's take a look at some of the typical functional problems patients are presenting to our clinics with. Symptoms such as fatigue or low energy, digestive disorders, allergies, reduced immunity, infertility, pain and inflammation, hormonal dysfunctions, sleep disturbances, skin issues, anxiety or depressive tendencies, weight fluctuations, and these are just some of the symptoms of a functionally disturbed patient. Most patients with these symptoms present without clinical findings, i.e. their blood tests, pathology reports, etc. appear within a normal range. Good news, your test indicates that you're in the normal range. This is actually quite a funny slide, but it's not really that funny if you're one of the people sitting slumped against the wall in your allopathic medicine physician's office, because this is the experience of millions of people. What we need is to look at these patients through a slightly different lens. By focusing our attention on the areas here and here, we can begin to see what's going on with them, not in terms of disease or pathology, but in terms of dysfunction. One of, if not the best lenses for looking at a patient is with a comprehensive blood chemistry and CBC or hematology test. With a functional analysis of a patient's blood test results, we can identify the cause of these functional disturbances before severe damage sets in, allowing you to bring the body back into its normal state of equilibrium. The blood chemistry and CBC test is the most commonly ordered lab test in the world, but there are still far too many practitioners that don't have a clue how to do a functional analysis. Blood chemistry test is the easiest, the cheapest, and fastest way to get diagnostic information from your patient about what's truly going on with them. However, way too many practitioners are missing out on an amazing opportunity to gather important clinical data about your patient's functional health. I used to look at my patients' blood tests and wonder why they always came back normal when I knew that they were by no means normal. Now, by using the techniques and a system I've developed, in about 5 minutes, I can figure out exactly what is going on with my patient's physiology and metabolism from a simple blood test, and so can you. How would you like to be one of those practitioners that can get an incredible amount of detailed, functional data from the standard blood tests you're already ordering for your patients? Well, you don't have to wait, because my one-of-a-kind system will teach you how. By using a unique method of analysis, you will be able to sleuth out the cause of the major dysfunctions that plague your patients. Arthritis, weight gain, hormonal problems, digestive problems, depression, insomnia, fatigue, inflammation, heartburn, stress, recurrent pain. The list goes on. These are just some of the many issues that people are seeking to get solved by coming to a practitioner just like you. It's important to remember that modern Western medicine really has no answer to these conditions. The real doctors have nothing to give the millions of people suffering from these conditions because you count the masking of symptoms with drugs and effective treatment. I'm sorry, but the real doctors in the 21st century are people like you and me, practitioners highly trained in the assessment, analysis, and identification of the real cause of dysfunction and disease. The question is, do you currently have the tools necessary to get to the underlying cause of these issues? Whether you're a chiropractic physician, naturopathic physician, clinical nutritionist, an acupuncturist, or a medical doctor, you are missing a huge opportunity, not to mention a substantial amount of income, by not using a functional blood chemistry analysis as a major part of your diagnostic and assessment services. With functional blood chemistry analysis, there's no more telling your patients that their blood tests look normal. No more wasting your patient's money. No more wasting your time by ordering tests that don't tell you that much. Finally, there's an easy way to improve your clinical outcomes. In Blood Chemistry University, I reveal to you a quick and easy system for analyzing your patient's blood test results from a functional, nutritional, and yes, preventative perspective. A system that will absolutely help you get more from the tests you're already ordering and to help you boost your practice. With the information I'm going to teach you, you can uncover the true cause of your patient's functional disturbances right now. And you can start giving them important information about the health of the different systems of their bodies almost immediately as you learn how to really interpret their blood test results. Do you want to know how truly powerful this method of blood chemistry analysis can be? Would you like to know what this type of analysis will do for your practice? Here are 11 powerful reasons you need to perform a functional blood chemistry analysis right now. 1. You're going to get excellent patient results. By implementing these techniques, you will be able to effectively address the majority of your patient's chronic health conditions. You're going to dramatically improve your clinical outcomes. You'll get more referrals. Patients are going to tell their friends that you are the doctor who finally provided the meaning to their blood test results. You'll be able to work on those hard-to-treat cases no one else can work with, because this method of analysis will make it easy to assess a broad spectrum of functional disorders. You're going to grow your practice. Your successful diagnosis and assessment and treatments will lead to growing numbers of satisfied patients. You're going to make money with the functional health reports. You'll learn techniques in this system that will put money in your pocket for a change. You will increase your competency with blood chemistry analysis, a wonderful thing to speak to your patients with authority when doing a report of findings. You're going to be able to determine nutritional deficiencies in your patients and put together cutting-edge protocols. And you're going to save yourself a ton of time by cutting the amount of time you spend analyzing your patient's blood tests. I mean a ton of time. Time taken to analyze lab work outside of your regular office hours eats up a lot of a busy practitioner's day. Using the software that comes with this system will put hours back into your clinical day. Blood chemistry testing is going to become an indispensable screening tool. You'll also increase the profitability of your practice. Here are a few things you'll learn after you join Blood Chemistry University. You're going to have an understanding of the implications for blood tests that are outside the normal values and implications of blood tests that fall outside of an optimal physiological range. This is not the same old things you've heard before, but new, innovative, and exciting ways to look at blood chemistries from a functional perspective. You're going to have knowledge of what tests to order. You'll learn what tests deserve to be on your standard panel and what tests don't. You'll learn how to put it all together. You'll have an understanding of the patterns that exist between tests and likely dysfunctions associated with the patterns. You'll learn how to turn your regular blood chemistry and CBC tests into an incredible prognostic marker for dysfunction. And if you're like me, you want to stay ahead of the game with new and creative ways to evaluate your patients. Many practitioners are looking for tools that distinguish them from other clinicians in their area. Being able to diagnose and assess a condition long before it becomes a major problem is essential. This is what functional blood chemistry analysis can do. Patients are looking for practitioners that can help them navigate through the myriad of signs and symptoms they're experiencing. And being able to do a functional analysis of their blood test results will make you stand out as a practitioner. At Blood Chemistry University, you will learn how to identify the key metabolic and nutritional problems that affect the majority of your patients. Knowledge plus tools and system equals success. So what do I mean by that? In the past, I focused on providing the very best in training material, which is really about imparting knowledge to you in the hope that you can take that knowledge and apply it in practice. But it's clear that you need more than just knowledge. So by combining the very best in online education and the very latest in analytical software, you have at your disposal an amazing system for creating long-lasting change in your patient's health and well-being. So the Functional Blood Chemistry Mastery Certification Training Program is where knowledge and tools come together in a powerful training system. So the first part of this system is the training itself, which is what I call kind of the knowledge portion. So I want to switch over. I'm going to go over to the training program, and I'm going to show you what you're going to get access to. All right, so here's my login. I've already logged into my part of the course here just to give you a demonstration of what the training program looks like. So once you've logged in, you're going to get a username and password that is yours for the Optimal DX Academy. And you're going to click in here and you go straight into the training program. So you can see here a little graphic telling you what the course is. You have the class curriculum here and you can start and you can jump in anywhere really, as long as that particular module or session is active. So we start out with 3 sections available to you right away. So we have our orientation, where I do some walkthrough videos. We have our intro to blood testing and the functional approach. Good place to start if you're interested in learning a little bit more about blood testing and essential biomarkers that you might want to run, and then the ODX panels and that sort of thing. And then we jump right into the GI function as our first main section. And this is a timed drip course. So October 24th, 2018, the next module will be available. That's 18 days from today. Obviously a bit closer for you if you are registering down the road. And then we start off with the red cell function, looking at nutritional anemias, and then nutrient deficiencies, blood sugar regulation, adrenal and kidney function, thyroid function, cardiovascular function and inflammation, sex hormones and prostate function, and our final main section is the immune system, and then we have a putting it together. I'll do some case studies and things like that. We also have some resources that are available to you right away, so we can click into those. This is basically some information about my books where you can get hold of them. This is some tracking forms, and there's a little PDF viewer here, and then you can actually download the tracking form. It's not going to actually let me do that because the screen's too small. But yeah, you can download the tracking forms there. And then we have some, always the curriculum is always on the left-hand side here. So we have some bonus presentations. This is a Treating GI Dysfunctions by Dr. John Brimhall from Brimhall Wellness, talking about how he uses his 6 steps to wellness system to treat the GI. It's a great little bonus presentations here. Liver detox from Dr. Dan Kalish from the Kalish Institute. Quite a few from him. We've got adrenal lab analysis. Good colleague of mine, Dr. Nicholas Hedberg, is talking about autoimmune thyroiditis, etc. So I'm going to scroll back up here through the curriculum and just kind of give you a sense. Let's just choose functional physiology of the GI. So basically the way that this works is there's a video, and then there is the MP3 that you can download. You can either listen to it here or you can download it. And then there's the PDF rendering of the handout, and then also you can download the handout from below. You can always go back here if you want to read a little bit more about me. There's my lovely mug right there, and a little bit brief bio. But this is the training platform, so hopefully that will be helpful and useful to you. So I kind of want to summarize the Functional Blood Chemistry Analysis Mastery experience I've just shown you a quick walkthrough of the training program itself. So here's what you're going to get when you join the training portion of this system. You get 12 online video training sessions. So you saw those training sessions. They are released sequentially over time. But once you have access to all of them, you're going to get lifetime access to the training program. So what do I mean by that? There's a whole load of people that has taken online training with me in the past. They're getting access to this new updated program for free because they joined me in the past. So as I'm adding new material, I might be changing this. I want this to be a place where you can come back to, you can get updates to your training experience and that type of thing. As we saw, every video session has an audio and PDF downloads. We've got bonus trainings from the leading functional medicine experts. Something I'll be talking about in a few seconds is the free professional ODX software account. You're going to get 3 months of a pro account. That's $525 in value. And if you're into the certification side of things, I'm going to have coaching calls. We're going to have examinations. We're going to have a final exam. We're going to have case studies that you're going to have to do, an exit interview with me. And then ultimately, if you go through all of that, we're going to give you a certification certificate. And those people who are certified and using the software on an active basis, these are the people that I want to refer our clients to, that we get visiting Optimal DX all the time. So that's the training or the knowledge portion of the training system. So now let's take a look at the tool section. So the tool portion of the training system is my ODX software platform. This is kind of a little view of it in this particular window. So as part of your training, you're going to get not only all of the training that I just talked about, but you're also going to get 3 months of an unlimited professional account in the ODX applications. Like I said, that's a value of $525. So this is going to give you plenty of time to really get to grips with the software. You're going to be entering in a lot of patients, entering in as many blood tests as you want. You can run as many reports as you want, including our brand new core interactive PDF, and I'm going to show you what that looks like in a few minutes. You'll be able to do some consultations. You're going to be able to wow your patients. And so it's a really, really powerful tool. So I want to take this opportunity actually to do a brief software tour. So to kind of show you what the inside of the software looks like, and then also show you some of the reports themselves. So bear with me as we switch over to the software program. All right, so I've logged into my ODX application. You can see you can add a little profile photograph here that will get included in the reports. One of the things I think you'll notice right away is really how simple we've kept the dashboard. So this is what we call our dashboard. And from here, you can get pretty much anywhere within the program with just a few clicks. So we felt that there were 4 things that you might want to do when you come to the software. One is to add a new lab test for an existing patient, or even add a new patient at that particular time. You can add a new patient, and the only thing that we need to collect on your patient is first name, last name, date of birth, and gender. That's it. We're not an electronic health records, so we're not really that interested in collecting a whole load of demographic information about your patients, just enough for you to be able to identify who they are, and that information then gets put onto the reports. A lot of people just come in here and they just click generate reports and they jump right in and look at reports. And then also looking at the view patient list is an opportunity here to view the patients that you have in your system. From the dashboard, you can go over to the blood reference guide. This is my updated digital version of my book. Let's take a quick peek. So we've got all of the different biomarkers in this list here. And then basically discussion, some ranges, some lows. There's little hyperlinks here, the drop-down menus. What do highs mean, some other information about conditions low and high, interfering factors and drug associations. So all of the biomarkers that are currently in the software are available for you to do some more information. Here's bioavailable testosterone and all of that information. So that's the clinical reference guide. We have the clinical conditions guide, and this is where I kind of go through some of the information that is included in some of the reports, but this kind of gives you a background of my approach to looking at adrenal function, adrenal insufficiency, adrenal stress, and that type of thing. We also have obviously a link to our training program. The other thing we can do is convert ranges. So we convert from US back into standard international units. So this is a built-in converter that we do that. The great thing about the software is it can handle US ranges, and it can also handle standard international units. So any practitioner anywhere in the world can use the software. We've got some plugins here. We've got some nutritional supplement programs. We've got lab test importing, and this is where you would do that. We've got, I think, 13 different lab companies that you can enable and do product-specific reporting on. Let's go jump into the patient list here. And this is a list of all the patients. Some of the nice things that we do is tell you when their last lab test was run. This is a great way to do follow-up. So if this was, actually this is me, but I use as a sort of a test account, but this person hasn't been in for 300 days for a blood test. Guess what? That's money on the table that you're leaving behind. This person should be approached, bring them back into the program, and this is some of the stuff that we talk about in the putting it all together, section 12 of the training program. Let's jump in and take a look at James Bond here, and we go through to what we call the patient dashboard. This gives us some basic information about the labs that are in the system. We've got a history snapshot, so we can look at all the different values. We always move from left to right, so the latest blood test is always on the right, because I like to see change occurring as we move our eyes from the left to the right. We've got functional systems snapshots. You can see if there's any scheduled lab tests. You can actually go in and look at the previous lab tests. You can edit the results if you want, or you can jump straight in and generate reports. We've got a nutrient status here, and then we've got clinical dysfunctions as well. So what I want to do is I want to generate a report on this guy and show you what the report center looks like. So we've got two styles of reports. We've got our brand new core report, which is an interactive PDF-based report, and I'll show you what that looks like in a few seconds. And then we have our classic report. So for those of you that might be using the software, classic is the older version. It's an on-screen view, and then you can also print that to PDF. What I like about core is that it's fully interactive, so you can jump between the various different sections of the report itself. So basically, in order to use the report center, you come in and choose the patient, you choose the lab report itself, and then you get some other choices here. You want to do it either in conventional US or standard. I'm in the US. This was put in US units, so I'm going to do a conventional US one. Is this a practitioner or a patient? This is practitioner. And then what kind of products do I want? Let's do Zymogen. I like Zymogen. And then I can choose what kind of cover I want. Do I want a dark cover or a light cover? We also have two color schemes. We have a sort of a blue, chromatic blue scheme, which is currently our default. And then we have a traffic light. So I actually personally like traffic lighting. I'm a traditionalist. I like the red, green, and sort of orangey yellow. So I'm going to choose traffic light color. We have four main sections of our report. We have an intro section. So we've written some short little articles about functional blood chemistry analysis. You can put some practitioner notes in if you want, and that's available on the data entry page. A little info about the actual practitioner report itself. And then we have our assessment sections. Assessment sections is in two sections. One is a graphical representation, and then that moves over to a more detailed report of anything that's above 50%. And I'll show you what that looks like when we actually render a report. Our third section is our analytics. This is kind of where we dive into the ODX optimal ranges. We have a blood test results report. We have a blood test results comparison report where we look at the previous blood test against the current. We have a blood test score where you can see which biomarkers are the furthest away from optimal high and furthest away from optimal low. We have a really good looking blood test history report with an infographic here that kind of shows you the movement over time through an optimal. And then we have our out of optimal range report, not so important for you, the practitioner, but really important for the patient, because this allows you to spend a little less time talking about individual biomarkers, because there's an explanation of why a particular biomarker might be out of range. And then for those of you that are on the Pro plan, which of course everyone who's joining the training is going to be on, we have our health improvement plan. And this is kind of where we summarize everything that we've looked at in the previous two sections, and we come up with the top 8 clinical conditions and deficiencies that need attention. So we have our health improvement plan, we have a product summary, And then we also have recommended further testing. So this is where if a value is really out of range, so let's say for instance this guy's male testosterone, which I know for a fact is something that he's dealing with, is way out of balance, then this might suggest that we do some male hormone testing and that type of thing. And then a final report is what to look for. This is a pretty in-depth, more reference and research-based report for the practitioner to try and get a sense of what's going on at a sort of a deeper, more macro level. If we want to jump over quickly to classic, we just hit this button here. It preserves everything that we've looked at. I'm going to go ahead and just select all here, and then I'm going to run the report, and then you can see on the screen itself what the report looks like. The reason why we did core was that this is very linear. I can't move between sections. So I can't go, oh, well, what is the glucose? What does this actually mean? So it's a great report. Obviously, we use this for many, many years. And for some people, this is still the report that they prefer to use. But for me, I like the interactivity of PDFs. So let's go back to the report center itself. And I'm going to switch back to core. And I'm going to go ahead and make sure that all of my parameters here, let's select Zymogen. So we've got name, we've got the lab test, we've got conventional US units. Zymogen, I want a light, traffic light color. And now I'm going to hit create PDF. All right, so this is the PDF of the core practitioner report that I just generated. So I want to show you very quickly kind of what this looks like. This is the light traffic lighting version. As you can see, we've got some information about the patient. There's my face here, so you can upload your own profile photo. And the first thing you want to notice is that this little button here is actually hyperlinkable. So you click that, and it jumps you straight into the kind of what's inside section. So I'm going to point out a few features here. These are all hyperlinks. This button here takes you back to what's inside, so you can be anywhere in the report and you can jump back to this page. These buttons here move you to the next report, front and back. These are all hyperlinkable across the top. All of these are hyperlinks, so you can jump straight to a particular section of the report. And as you can see, we have our 4 sections: intro, assessment, analysis, and health improvement plan. So this kind of jumps you right in. So let's take a look at, we have a little article on functional blood chemistry analysis, very helpful for the patient. We've got a practitioner report thing. Jumping back in here, let's jump to the functional body systems. So this is our body systems report, probability of dysfunction in 13 different body systems. Anything above 50% is hyperlinkable. So if you click this, it jumps straight to a section in the document where it gives a little written information about it, the rationale behind it, the biomarkers considered, and what biomarkers were not run that you may want to consider in the previous, in the next test that you might want to do. You can click this, takes you right back to this particular section. So you can jump anywhere back and forth in the report. So that's the functional body systems. We have accessory systems, same looking report, macronutrient status, nutrient deficiencies, and clinical dysfunctions. This is kind of where we look at the actual dysfunctions themselves, and again, completely hyperlinkable back and forth. So really super good for those of you that are doing online coaching, even sitting down with your patient with a computer screen, a laptop, or an iPad. This really makes it very, very easy to do your reporting. I'm going to go back up here to the what's inside. I'm going to jump to the analytical section. So these are the actual results themselves. I can jump to any particular section within the report from this particular page. We've got our infographics here. So you can see we've got our sort of magenta color here is our alarm highs and low. We have our reds for above or below the standard range, orangey yellow for below optimal, and green is optimal. So this one has 47 out of a total of 75 within the optimal range. So let's jump in here, look at blood glucose. Again, we can very quickly, from a graphical perspective, the color of this circle changes based on the area. So I know that this is above optimal. Green is optimal. This is also hyperlinkable. So anything above or below the optimal range is hyperlinkable. I can click this and it takes me straight into my out of optimal range report. I can read a little bit about this. I can click this, I go right back to it. So all of the sections are available for you to review. So that's a nice way to be able to review the actual blood test results themselves. They're all categorized, so it kind of makes it easier for you to contain your discussions about various different systems with your patients. I'm just going to scroll through here pretty quickly. And as you can see, a lot of blood biomarkers are being run here. Next one is our blood test results comparative. This is looking at our current test versus our previous. And we have an opportunity to see whether there is improvement. So this one's still out of optimal, but I know that 94 is moving in the right direction. Again, moving from left to right, always looking at our previous, looking at our current this way. So we can go, oh yeah, you're 94, now you're 90. This one, you're 5.7, now you're within optimal. This was 7, now you're 6.4. You were 7, now you're 9. You're moving in the right direction. Uh-oh, creatinine, you were optimal, now you're out of optimal. So this is the comparative report. We've got our blood test score report. We look at the furthest value away from optimal is at the top. So this triglyceride value is really out of range compared to the others. And this goes all the way down to the bottom here as well. Then we have blood test history, looking at values as they change over time. As you can see, this one has never really been in the optimal, but they're definitely moving in the right direction. So there's a nice little infographic here. Imagine if you had 6 tests and you can see this line weaving in and out. Our out of optimum range report we've looked at before. This is our health improvement plan section. These are all hyperlinkable here within the title page here for section 4. So the health improvement plan is the top 8 clinical conditions and dysfunctions that we need to look at, plus nutrient deficiencies. So we've got metabolic syndrome, hyperlipidemia, DHEA need. So metabolic syndrome, this is why this particular case, the metabolic syndrome, is pretty out of balance. These are the Zymogen products that are recommended for this particular area. Got a nice little graphic here, product name, dosage descriptions, and that type of thing. I'm going to jump actually to the product summary because I think this is a nice little report where we summarize primary products on one page, and then we have secondary products as well. So you can print this up, give it to your patient, show the ones that you want them to take, and they can put that on their refrigerator. Recommended further testing. This person needs additional lipid testing, needs some zinc sufficiency testing. So this would be the NMR, VAP testing, that type of thing. And then our final report is our appendix and the what to look for. This goes into way more detail on the various different reasons behind increased glucose and that type of thing. So super excited to get this to you. Thank you so much for watching this. And let's get back to the presentation. So there you have it. I just gave you a quick software tour. I showed you the new core report. But ultimately, let's get back to the certification training. This is a certification of training that's really going to provide you with everything that you'll need to be successful. You're going to have the clinical knowledge and an amazing tool to apply that knowledge so you and your patients can save time and money and get results fast. Plus, you're going to get an opportunity to get certified as a functional blood chemistry analyst. So who's going to benefit from this certification training? Certification training is for you if you want to dramatically and immediately increase your diagnostic abilities. It doesn't matter what type of clinic you have. It's perfect for anyone with a background in the health sciences who wants to learn a system of functional blood chemistry analysis and CBC interpretation that really works. It's ideal for licensed naturopaths, chiropractors, acupuncturists, medical doctors, DOs, nutritionists, dietitians, nurse practitioners, pretty much anyone who's open to a new way of looking at some of the old information. This course was created for those who've been in practice for a number of years and are looking for something to complement what you are already doing, or those who are just starting out and those who are still in school. It's geared to any practitioner of the healing arts who want to stay ahead of the game with new and creative methods of evaluating their patients. So why should you get certified? Well, over the years, our web presence has grown to the point where we're getting inquiries from people asking to be connected to practitioners that have been trained in my work and are using the ODX analytical and reporting software. If you could imagine that you're a patient, you come to our website and you see this incredible looking report, you're going to want to get your hands on one of these. Well, it's only available to practitioners. So these people contact us and say, can you please let me know of a practitioner in Tulsa or Seattle or Portland, Oregon or Portsmouth, New Hampshire. Let me know who these people are so we can refer you to them. So these people have seen their functional health reports and want someone to help them get the same level of information on their blood tests. So in order to refer these people to you, we need to make sure that you have been through a course of education, have been trained in my work, hence certification. So getting certified is a way for us at ODX to feel totally comfortable making that referral. Also, you're going to be part of a growing global tribe of functional blood chemistry analysis specialists. We'll help you, your work and your clinic will help get it out in front of the thousands of people looking for practitioners, can help provide meaning to the massive healthcare data that they have available to them. So if you want to enhance your clinical offerings and learn the latest and greatest tactics and strategies that actually work to get more assessment info from the tests you're already using, you want to expand your current assessment and diagnostic offerings, you want to distance yourself from the practitioner down the street and start increasing your clinic income, then this certification training program is for you. So by now you're probably wondering what the cost of all of this is. So firstly, I think it's important to remember this is a 100% online course and you're going to get lifetime access. So what does that mean? That means as long as this course is up on the internet and available for sale, you get continued access to it. As I mentioned earlier, there are people that have been in my trainings in the past 3, 4, 5 years ago. They're going to get access to this updated program because of my commitment to providing lifetime access. This means if I do an update to the training and I add more lectures, you're going to get continued access at no extra cost. Secondly, we've got 2 tracks. We have training or training and certification. So let's talk a little bit about training only. So if you're interested in the training only, then the cost is a one-time payment of $9.97 or 3 monthly payments of $3.75. So as a reminder, here's what you get for that. You get access to the 12 training modules, you get lifetime access, you get audio and PDF downloads of every video handout and every audio from the training. You're also going to get bonus trainings from leading functional medicine experts. And finally, you're going to get a free 3-month professional blood chem software account. That's a $525 value. And all of this comes back with a 30-day free look policy, which works this way. You have a full 30 days to preview the training program, 30 days to test drive the powerful blood chem software, which in and of itself is a $175 value. If you decide during that time that this isn't for you, just let us know. You'll be issued a full and prompt refund, no questions asked. In short, you get a great return on your investment, or you get your money back. It's that simple. And for those of you who want to get certified in this work and join our growing tribe of functional blood chemistry specialists, then for the first time ever, I'm offering a certification track. So the certification track is a one-time payment of $14.97 or 3 monthly payments of $5.25. And so for the certification, you get all of the training program, plus you become a functional blood chemistry analysis specialist. You get a certification. We're going to do 4 live coaching calls. So this is where you get to ask questions throughout the training. There's going to be 11 review quizzes at the end of each section. There's going to be a final certification examination. I'm going to ask that you do a case study of a blood chemistry case. Don't worry, all the details of what that looks like will be in the training program. And then finally, we're going to do a face-to-face video meeting over Skype or GoToMeeting or something like post-training. I want to talk with you. I want to find out that this is something that you're really, really interested in. And if everything goes well and you pass all of that and we're all really super happy with it, we'll get a printable certificate and you will be a certified ODX functional blood chemistry analyst. And then you'll be eligible to be part of our directory as we move in that direction. So register now. Click the Get Started Today button below this video. I'm super excited to be back here again doing a training with you guys, and I look forward to seeing you on the other side, being part of your coaching experience, touching base with you, answering your questions and that type of thing. But yeah, hit the Get Started Today button and choose whether you want training or training and certification, and I'll see you on the other side.